I say what comes from the heart goes to the heart. My whole thing is taking care of people. I'm Dr. Eugene Scott Jr., Doctor of Dental Surgery. Everybody's interested in aesthetics, the way they look. Naturally so. So that's why we came up with the name with Sunny Smiles. We started doing dentistry here in Huntsville in 1976.
In those days, we had medical dental care from the Army. As I approached retirement, one of my benefits that went away was dental care. I'm Tom Brown. I'm a retired Army officer and currently work in defense industries. Every time I walked through the door, I met a staff that was very professional. Dr. Scott is unusual. He did free dental care for people. He gives freely of his time to work on their greater problems than teeth. I've seen his work, I've seen what he does, I've listened to him. I'm thrilled with what the man does.
When I started in college, frankly speaking, I didn't know what I wanted to do, you know. Like so many youngsters in liberal arts, I met some of my fraternity brothers, and I was very impressed with one particular fraternity brother who was interested in going to dental school. When I graduated from undergrad, I had almost enough cumulative hours to have graduated twice. That's how many classes I took, trying to find where my interests lie. And that's how I got involved with dentistry.
One of my teeth, they was growing together, closing in. It was very difficult. I mean, if you had a picture of it, you would know it's just 100% different. My name is Elizabeth Townsend. I'm a pastor's wife. I'm before the public a lot. And it's important to have your smile together. I feel good about my mouth. I love smiling again. And not only am I happy with it, my husband, he loves it. And now I'm not ashamed. It feels good. I don't think about it anymore. He makes you feel welcome. I trust him. I think he did a beautiful job. I'm not saying it because it's me, but I love smiling again.
I've often said that the medical profession, many times we outprice ourselves. We charge ourselves to the point where patients can't afford it. So what good is there to provide a service or to have a service if a patient can't afford it? So we do implants, and we charge a minimum fee for some of our implants $750. Well, some of my colleagues charge $2,000 to $3,000. My highest fee for an implant is $1,500 because of my surgery background. Allows me to do these surgical procedures, and at the same day I do the surgery, I'm able to deliver the denture. So the patient comes in with their teeth and leave with a brand new set of teeth.
When you step out and smile at somebody, you want to be, you know, as nice looking as possible. My name is Mary Breach. I'm a retired nurse. I've been coming to Sunny Smiles for, for 7 years now. I needed alignment. I had a cantilever that was giving me problems. No one has stated to me that something really positive could be done. When I came in and talked with Dr. Scott, he said, "Oh, we can take care of that for you." He's taught me what to do with my mouth and teeth. What keeps me coming back, when you come into the dentist's office, you want to feel welcome. And I always am welcomed. I would recommend it highly.
It's about taking care of people. You always want patients to feel as though that they're human and they're not just a number. You know, you just don't come in and start working. If it's a new patient, I want to know where they're from. I want to know if they're from Huntsville. Oh, I'm from South Dakota. Oh, I've never been there. Tell me about it. You know, how many kids you have? Tell me about them. Well, that takes a little bit of time, but so what? That's time well spent. Because you want to bond with your patients. You want your patient to bond with you. And that takes care of that. Just to me, that's very important. It builds trust.
One of the greatest experiences that I have had is my implant. My name is Lance Shand. I am a teacher and preacher. I've been coming to Sunny Smile now for a number of years. As a matter of fact, it's 33 years. I'd be talking to my students and the uppers are rattling. Sometimes they try to come down. That's most embarrassing. All I can remember, the doctor drilled a couple of holes in my upper gum. That was fantastic. And by the way, it is painless. It is painless. So if you look at my teeth right now, there is no decay. And I can smile. I can smile very much. This is the place that you would want to have your dental work done. Not only yourself, but your children as well. And I've had a wonderful experience. And that's why I can smile like this. See, son is smiling.
I do the smoke cessation. I can always look at a patient's mouth and tell whether he smokes or not. And I invite each one of these patients to come to my Stop Smoking clinic that I present in this office, free of charge. Don't charge a dime. And I've been doing this for years. And we'll take them through a 4-day seminar, and we'll get them off a cigarette.
I've been coming to Dr. Scott for about, tell my age, about 30 years, I guess, or more. My name is Pearlie Stamper, and I'm the administrative aide for the Huntsville City Council office. When I moved to Florida in 1983, it was difficult for me to find a dentist that I was very comfortable with. And so my husband had to come to Tennessee quite often. So I said, well, since we got to go to Tennessee, I'll just schedule my dental appointments when we go home. I came up from Florida for about 5 years for dental appointments with Dr. Scott. First, I had 2 partials made, and I had difficulties, you know, with putting them in and out of my mouth, and they just didn't feel right. I had talked to Dr. Scott about having implants, and for some reason he was like, well, we don't know if you can or not, you know, but we'll try. We'll do some tests, and we'll test your bones, and we'll see if it's, he checks out everything. I mean, he doesn't take any chances, you know, so he checked it out, and he said, well, I think you'll do well. It was a big success, and I'm just so pleased with them, and like I said, I've been smiling ever since.
These nursing homes don't have the necessary manpower to clean their patients' teeth. The plaque builds up on their teeth in increments of millimeters. And the plaque is made up of bacteria. These patients swallow the saliva filled, laced with bacteria, and the saliva goes down into their trachea, into the lungs, and into the heart, causing pneumonia and causing heart disease from the bacteria in their mouths. I'm the only dentist in Madison County, if not North Alabama, that go to nursing homes and take care of patients in the nursing homes. I have patients that can't get out of bed that need dentures. I have the talent to go in that patient's room and make them a denture, a full upper and a full lower denture from start to scratch, and they've never left their bed.
My name is Ron Childress Jr. I am an agent with Alpha Insurance. July 3rd, 2008, playing softball. Me and another player, we collided. And I was rushed to the hospital. Hospital can do anything. Apparently, my premaxilla separated from my nose bone. In layman's terms, my teeth got pushed back towards my throat. I didn't know what was going to take place. I didn't know how I was going to get my teeth fixed. But a phone call was made to Dr. Scott. Dr. Scott dropped everything that he was doing, time with his family, his vacation time. He came and opened up his office. No staff, anything. He came and opened up his office just to fix my teeth. That was the fastest dental procedure I ever had in my lifetime. Dr. Scott to me is not a dentist. Dr. Scott is a blessing. And his services will always be unforgettable.